When you arrive at the Mission of Mercy, you'll be greeted by a parking attendant who will direct you to the volunteer parking area. You'll then proceed to the building, find the volunteer check-in. You'll then be directed to the community volunteer table where you will sign in, you will get your name badge, and you will be given the name of the lead for the day that you'll be working with. You'll then proceed to the table to receive your t-shirt or your scrub. At this point, I would like to remind you that there is no area at the clinic for you to keep your personal items. You can leave through the exit door, put your personal items in the car, change into your t-shirt or scrub, and come back in the re-entry door at the clinic. Upon re-entry, you'll then be directed to the area of the clinic which you volunteered. At that point, you will begin the training with your lead for the day. Now let's look at the day in the life of a patient at Rhode Island Mission of Mercy. A typical day for Mission of Mercy starts in the early morning, the day of the clinic, as patients arrive and wait with others for the clinic doors to open. Some patients arrive the day before to wait in line for services. Before the clinic doors open, patients are given numbers to ensure they can be seen. At that point, patients then are directed inside the building in order of the number they were given and arrive at the patient consent station. Once there, they must sign a Mission of Mercy consent form to receive dental services. Once the consent form is signed, the patients keep their forms and move to the patient registration area. Once at registration, general information is entered into our Mission of Mercy software. Once completed, this will serve as their patient chart for the duration of the day. They will then receive a wristband with their patient number on it. Their completed consent and registration forms will be put into a folder and they will move to the medical triage area of the clinic. From this point forward, patients will be escorted to all other areas of the clinic. Patients at the Rhode Island Mission of Mercy are never without an escort until all their treatment has been completed and they have been through patient checkout. Once in medical triage, patients will complete a health screening where their vitals are taken and recorded in their patient chart. Any medical issues are addressed at this time, and if cleared, patients are then escorted to the dental triage area. Once in dental triage, patients will meet with a dentist, discuss their chief complaint, and the dentist will determine the treatment they will receive. Before leaving dental triage, they will meet with the patient assignment lead, our wizard, who will confirm the procedure. The patients are then given their treatment routing card, indicating the procedures they are having done. At this point, patients are escorted to the patient holding rooms. The holding rooms are specific to the procedures they will be having done. Once there's availability in the clinic, they will be called down for their treatment. Patient education, as well as a variety of community agencies, are located in the hallway outside the holding rooms. Patients can visit these while they're waiting for their treatment. Patients will receive lunch and snacks in these holding rooms. Once in the clinic waiting area, patients wait for a clinical team member to alert them they are ready to be seen. Endo and restorative patients will be called into local anesthesia station to be numbed before their treatment. After completion of their procedure, patients will then be escorted to the patient checkout or the Rhode Island Mission of Mercy pharmacy. Patients will complete a questionnaire and return completed patient chart and consent form to the checkout personnel. Once a patient is checked out, they can stop at our clinic appreciation station, where there'll be sticky notes where they can jot down a thank you or a sentiment to a doctor or a community volunteer to tell us about their day. At this point, the patients are escorted out of the building, and that is a day in the life of a patient at Rhode Island Mission of Mercy.